Hey.
Hey, Miss Mary Jean.
Hey.
You feel a little bit better now.
Yeah, I do. I do.
I'm glad you kept that positivity, okay? So we're going to talk a little bit about, you had your surgery. We're going to talk about the condition you have now, which is hypoparathyroidism. So the doctor did come in and kind of tell you a little bit about it?
He did, yeah.
Okay, so we have some new medications for you.
Okay.
And, we're basically going to tell you a little bit about the disease.
Okay.
So the main thing with hypoparathyroidism, the disease you're diagnosed with, is that you're going to have low levels of calcium and high levels of phosphate.
Okay.
So low levels of calcium, that's going to affect your bones. So we're going to want to kind of keep you mobile. We're going to keep you moving around.
Okay.
I know you still do your daily walks we talked about earlier today?
I do.
Okay, so that's a good thing. Exercise in moderation, right? We're going to kind of change your diet to increase your calcium levels. I want you to kind of drink more milk. I want you to eat leafy greens.
Okay, I like that.
Okay, and what's your diet now? What do you normally eat at home?
So in the morning time, me and some of my girlfriends, since I'm retired and everything, we'll go out and we'll do like brunch. And so we'll normally do like eggs Benedict. We'll do like, of course we have to have our mimosa and stuff like that. So I might have to kind of like cut back up on that, but don't tell the doctor because I told him I'll drink. But we'll do that. We do like yogurt and I try to stay away from like the meats and stuff like that. So we do a lot of vegetables and stuff like that. So I do pretty good.
So you're on the right track. The thing I was going to tell you, stay away from processed meats, processed foods. We want to try to eat cleaner. I see you're doing the eggs Benedict. Most of that stuff's not really processed anyways. So, that's great. You're on the juice. Not too much carbonated drinks, things like that.
Oh, no.
So good with leafy greens. If we can, we want to kind of add some things with a little bit more calcium. So like sardines, for example.
Okay, I can do that.
Or, all right, perfect. So, that has little fish bones and increases your calcium. All right, we are going to bring you in for normal labs.
Okay.
So we're going to do your normal follow-ups. I know you kind of probably come already at 6 months. We're going to make that more often.
Okay.
We're going to also add a urine analysis to that to make sure you're not having any calcium.
Okay.
If you do, there's a medicine we can kind of give you, and it'll kind of, keep it away from your urine and pull it into your body. We want to keep your calcium. We don't want to waste it. Any questions so far? Okay. So a couple things. With low calcium, this can affect your heart. It can affect a lot of things, okay? So we are going to have to kind of do more normal cardiology checkups.
Okay.
And if you have any signs of low calcium, we need you to call to the doctor and figure that out, right? So signs of low calcium is going to be mostly muscle spasms. So you might have this in your, legs. You might even have some pains. So one of the medications we've added is normal Tylenol, acetaminophen. So this is going to be for your low levels of pain. We got the dose on there, how many times it take you. You're going to take it every 6 hours. We're not going to go over about, that certain dose is written on there. So look for these signs, and it's not so severe in your, legs and arms, but it's more severe if it gets up to your chest area here, because you can have some esophageal issues. That's more of what we're worried about. We want to catch this early.
Okay.
All right, so we got diet. You have a good understanding of the disease so far? And you got this hyperparathyroidism. It was kind of due to the surgery. The surgery was a necessity, but it's just some things we gotta kind of attack from there, okay? You don't smoke, do you?
No.
Okay, that's great. Okay, so we're gonna continue to monitor for low levels of calcium. Do you have a history of seizures at all? Okay, so if you ever have a seizure, that's something we need to follow up for. Just look for signs. Make sure you report any changes.
Okay.
Okay. What's our other topics we got on there? So medications. Medications. Okay, so we got you a high blood pressure medication. Is that a new medication for you?
It is, and with this lisinopril, I've developed this cough that I just cannot get rid of.
Okay, so lisinopril, for that medication, it is normal to have a little bit of cough. We're gonna try to see if that works for you. If it's really bothering you, we can change you to a different medication. It'll kind of get rid of that cough, but most of the time these medications do have a little bit of a contraindication, or an expected indication rather.
Yeah, he told me that I've been on it for like 2 months, and he said to give like another week, and he said if it's still bothering me and if I still have it, because it wakes me up out of my sleep all day and I don't like that. He said if I still have a problem, he said we can come off of it.
Okay, so he said give it another week? Okay, well, I don't want it bothering you in your sleep, so just see how it does for you. Now, I do want to tell you, so look out for signs of swelling in your face. So that's something that can be normal for this.
I did have some tingling in my lips.
You had some tingling?
When I took it here 2 weeks ago.
Okay.
Then I took a Benadryl, it kind of like went away.
Okay.
But since I've been here in the hospital, I've noticed that too.
You noticed that? Have you had any swelling at all?
Just the tingling in the lips.
I'm sorry. You never had any something called angioedema or anything like that in your face? You've never had that before?
No, because my face kind of puffy anyway. So if it has, I just really haven't paid attention to it. So I guess I need to watch that.
Well, I'll tell you what. We're going to go ahead and talk to the doctor here today and see if we can get you on a different medication. We don't want you to be at higher risk for the angioedema because that can block your airway. So I'm going to go ahead and handle that here today. How have you been interacting with the other medications? So I see we got one for your cholesterol. We already talked about the pain one.
Well, what I've noticed like some leg cramping, a little bit with that. When we went up to with my Sebastian, and I noticed that when we went up on the 40, but I did fine on the 20, but my numbers just wasn't coming down or whatever. So I go back to my doctor next week, and he said he may take me off of that one and put me on another one or whatever. So that one, he said if I continue to have like the muscle cramps or whatever, I've been doing like different things. He just said just come off, just stop it, and then we'll go on something else. So we're gonna address that. But if you're gonna address the lisinopril, that's like my main one. Is that the muscle cramps in the leg for this one is every now and again. It's only kind of like when me and my girlfriends go like to the gym. I kind of notice it. But cause I do take that one at night. I'm good about that one.
The lisinopril? That's when he told you?
No, my cholesterol medicine.
Cholesterol medicine.
But my lisinopril, that's the one that's like just been giving me the fits or whatever. Okay. So
yeah, we're gonna talk to him about that today. Now these cramps, you've been having cramps in your legs? And that's not only after the gym, that's kind of all the time.
Yeah.
Okay, I'll tell you what, we're gonna draw some labs on you today before discharge. We might need to hold off on that, just till labs come in because, you know, that's a bad sign. You might have low levels of calcium.
Okay.
Like I said, that can lead to further issues.
Okay, sounds good.
Yes, ma'am. So we're going to go ahead and do that before you get out of here. And you have been taking your medication up here, right?
I have.
You take it every day, right? A total of, or you take it once a week?
Yeah, because we were on one that I was taking. I was taking the vitamin D, and I had got up to like 5,000 IUDs, but that wasn't working, so they changed me to this one, and I take it weekly. And I've been doing pretty good on that one.
Okay, and you're not having any bone pain or anything like that? Okay, that's great, and we're going to keep the exercise. Okay, so we have a good understanding on that. We're doing good on diet so far. And like I said, we're going to talk to him. We're going to get you changed off of that hopefully today, okay?
Okay, sounds good.
All righty. Once we have them there, we got to hit. You have any questions so far?
No, no, if we're gonna address like those two medicines, that's like the main thing. So the only thing is just I need to make sure that I increase my food with my calcium. I don't have a problem like that. I don't eat any organ meat, so I'm good on that. I'm going to eat more fish that has calcium in it, and we talked about the sardines, which I can do that.
Yes, ma'am, that is true.
What about salmon? Is salmon a good fish that has like with calcium or anything? So I like salmon.
So salmon, the main thing is to have something with fish bones in it. So it doesn't really, you know, those fish doesn't have bones in it. That's why I said specifically the canned sardines.
Okay.
Yes, ma'am. So salmon, I mean, it's a good thing to eat. It's got omega-3s. Those things help with joint lubrication and things like that. But specifically, I want you to try to eat sardines.
Gotcha.
And then the leafy greens, all the high calcium foods. We're going for calcium.
Going for calcium.
Yes,
Gotcha.
ma'am.
Gotcha. Okay, sounds good. I think that's it. Okay.
And like I said, just make sure you keep us up to date with the cramping and things like that.
Okay.
But yeah, I'm gonna talk to your doctor about that medication there, and we're gonna leave a number with you, and we're gonna give you some handouts just to kind of reinforce what we did today. So I'll have more specifically the diet plan, just some things to avoid, which you kind of avoid them already, and then the things to focus on.
Okay. That sounds good to me.
Yes, ma'am.
All right.
All right.
Thank you, Sonny.